So this is Zana. She's a 10-month-old rescue from Spain. So starting at the distal end of the limb, we've got the distal interphalangeal joints. So these are primarily flexion extension. So you've got P2, P3, P4 and P5 on the lateral side. Next, moving up, you've got the proximal interphalangeal joint. Again, these are flexion extension. So flexion and extension. All the joints again, just applying a little bit of overpressure to see if there's any pain response in them. And they're all okay. So I'm isolating above and below each of the joints to isolate that movement. Moving up, we've got the metacarpal phalangeal joint. Again, starting on the second phalanx, flexion extension, third flexion extension, fourth flexion extension, and then the fifth flexion extension. So all of these joints do have a little bit of medial and lateral deviation, but not excessive. Next, we have the carpus. So this has flexion and extension coming down. So we apply a little bit of overpressure to see if there's any pain response there, but nothing coming from Zana, and then full extension there. Again, this has a little bit of medial and lateral deviation, but that's not active movement. Moving up, we then have the elbow. So at the elbow, we have flexion coming up and then into extension there. So she's got really good movement of her elbow. At this joint, we also have supination, so fixing at the humerus, going into supination and then pronation there. And then next going up into the glenohumeral joint, which is the shoulder joint up here. We have extension there and then flexion in there. So she's young, so she does have really good movement of her joints. Lovely, and then we have a bit of internal and external rotation. Lovely, so just using the elbow as a pivot point there, fixing at the scapula to avoid excess movement. And then again, a little bit of abduction coming out, fixing the scapula, and then adduction going towards the body. So next we have the scapula, so finding the top border of the scapula. We have a ventral and a dorsal guide, so dorsal going up, ventral going down. And then we have a caudal and a cranial glide. And then of the whole limb, we have retraction coming back. Bringing her leg back, we do that slowly. Again, no pain responses there. And then we have protraction coming forwards. So no restrictions and no responses through there. So to assess this, we can use an objective measure. So we'll use the goniometer today. So we'll do flexion of the carpus. So putting the axis of the goniometer at the joint, and then the two arms following the bones. And we've got 30 degrees of flexion there. So normal flexion is between 30 and 35, so she's got good flexion there. So to summarise, absolutely nothing to note really. She's a young dog, so we wouldn't expect anything. She's fully relaxed here. She can move away if she needs to, but there was no adverse reactions to any of that.